Hello, hello. All right, here we go. Okay, today we are talking all things VBAC. A VBAC is a vaginal delivery after a cesarean, and I am excited to talk about this today. So, um, every time it comes around, I always go back to it. I had a patient text me this week and she had a successful VBAC, and I've been working with her really since after her C-section. So she knew that after her C-section recovery, or after her first C-section, which she wasn't like too thrilled that she was craving to have a vaginal delivery, wanted to experience that, just like a lot of people do, and ended up with an emergency C-section. And she was like, I'm going to do everything in my power to attain a vaginal birth. And so she started pelvic floor therapy to heal from her C section. And it had a great recovery, super quick, honestly. Her tissue responded really well postpartum after that C section. And she got her core back and her strength back, continued some maintenance throughout the year, throughout a couple of years, and then when she was pregnant, came back for a little bit more intensive birth prep to prepare for that VBAC. And I couldn't be more ecstatic that she had a successful vaginal delivery. And when someone is craving that vaginal delivery, especially after a C-section, it's you just want to experience it. It's that feeling. And then it's also the feeling, I hear this all the time, of people don't want to have to like chase around their toddler and experience C-section recovery again. And that's completely understandable. Now, some people elect to have an additional C-section and, whatever floats your boat, totally fine. But when you really want to have that vaginal delivery, then you're going to do everything in your power to really make that happen. And obviously, we can only control so much, but what we can control is seriously amazing. And so that's what I'm here to tell you today is really what we can control as far as preparing for birth and preparing to have a VBAC is so much. I'm going to explain what we do from a birth prep perspective and why this is so essential in order to prepare for birth. If you have had a C-section, you most likely have abdominal scar tissue. Hopefully, you were referred to a pelvic floor physical therapist and were able to work through the scarring in the abdominal area, and then also the elasticity and flexibility of the pelvic floor. And the reason that's important is because even if after you have a C-section, your pelvic floor is greatly affected. And so both pieces need to be addressed, not just the scar tissue in the belly. So in order to truly heal the core after C-section, you have to address the pelvic floor. And else you're not figuring out that, you're not building the entire core. You're just looking at the abdominal wall, which is just a piece of it. And that can lead to a lot of issues down the road. If you don't have your full entire core working for you. So when we talk about C-section recovery, or I'm sorry, when we talk about VBAC and preparing for a VBAC, we do a few things that are really essential. We work through the abdominal scarring. So that happens pretty gently if you are currently pregnant and prepping for a VBAC. If you know you want to have a VBAC and you're working to conceive, then that happens a little bit more aggressively, and it's a great time to happen. So if you aren't pregnant yet, but you know you want to have a VBAC, absolutely get a pelvic expert PT to really work with you on that, and have them take you through a preconception journey so they're addressing your scar tissue. Okay. And then that will make the prep for the VBAC that much easier. So you're not having to do it all during your pregnancy. And so, but say you are pregnant and you know you want to have this VBAC. Okay, what are we going to do? We're going to teach your pelvic floor how to open. So many times after people have vaginal delivery, people will say the baby was just not coming through my pelvis, or was stuck at a certain level, or I just didn't fully dilate, or the baby's heart rate started to descend and I wasn't making progress, so we had to change things up, and a C-section was the safest option, and totally understandable. The way if you're doing true holistic pelvic floor therapy and you're treating exactly what we do here at Body Motion, like we have these birth prep protocols. So I'm not talking about electrodes or anything like that. This is actual therapy for the pelvic floor, and it's sustained therapy. This is preventative to prevent C-sections, prevent perineal tearing. And insurance, unfortunately, doesn't pay for prevention, because if we're preventing tearing and we're preventing C-sections, they don't really care. But if you have pubic bone pain or low back pain, they'll pay for that. But they won't pay for this aspect of birth preparation and prevention. Even though if you invest in your pelvic floor during your pregnancy, it's going to save you so much money in staying extra nights in the hospital because you tore, or staying extra nights in the hospital because you had you ended up with a C-section. Like, that's where this is, like, the prevention. You invest now, the recoveries are so much easier. Than not. So it's just, I wish that everyone knew that. I wish this was standard of care, because this can change your whole birth experience. This can change your whole healing process, because people that go through this type of therapy before, during their pregnancy, don't really have to do much postpartum, and they can return to the gym pretty quick. They can return to their activities pretty quick, and they're not the ones that end up with issues 5, 7, 10 years down the line, because they had that consistent coordination and core work throughout their entire pregnancy. And it's not just doing Kegels, and it's not just contracting, relaxing, and bulging your pelvic floor. It's doing hands-on therapy that's going to help the pelvis open during the pregnancy, and open during labor, and the delivery process, and then also helping the pelvic floor get to new lengths, so that when the baby comes through, it's not just stretching the pelvic floor that wide and drastically for the first time. A good, true pelvic expert PT is going to take your pelvic floor to those levels before you go into birth. And the reason for that is because we want to create change in the actual muscles themselves and stretch in the muscles themselves. So before the baby comes through the birth canal, or when the baby is coming through the birth canal, this isn't a new place for the pelvic floor to be. So a lot of times what we hear when people go in to have C-sections is that they're not just, they somehow their baby like felt stuck, or they just couldn't like push the baby. They're pushing for hours and hours and hours because they just couldn't get the baby past the perineal body, past the pelvic floor opening. And when that's the case, then the baby can't descend. And so many people have tight pelvic floors. Everyone we see has tight pelvic floors. This is why tearing is so prominent during birth, and it doesn't have to be. A little road rash here and there is, you can stitch up after birth, and that's not a ton of scar tissue. Still matters, still should be treated postpartum. But, to have these massive tears during delivery, they don't need to happen if the pelvic floor is prepared. Even if your baby's head is in the 99th percentile, even if your baby weighs 10, 12 pounds, like, we have seen it all. And we know that babies that size can come through the pelvis and not wreak havoc on the pelvic floor or the pelvic organs. And that's simply by opening up the pelvis during pregnancy and really working through any restrictions, and then teaching the pelvis how to open, so that when it comes to birth, it just automatically knows how, and it's not learning how to do this for the first time, because the body's already going through enough during the birthing process and during labor. And if you've experienced that, you know that. And so for the pelvic floor to be super responsive is what you want to have happening during your labor process. You don't want to feel held up, or, when you're pushing through a brick wall, which can be a pelvic floor that's tight, then a baby is going to have a really hard time descending. And sometimes the baby doesn't descend, and that's when you end up with a C-section. And so much of what we do is working through that brick wall, making that brick wall flexible, making that brick wall, melting it so it's not a brick wall. And so then the baby's head can just come on through. Most of our moms push for less than 30 minutes. And it's an amazing reputation that we're getting across the board from OBs and midwives. And I couldn't be more proud, because we're starting to make a footprint in that. And people are starting to recognize when when they're done pushing, or after they have their baby, they're like, my pelvic floor just did the work. Like, I didn't even have to push. I was able to breathe my baby out just like you taught me, even if they had epidurals on board, or nitrous oxide or whatever. They could, even with an epidural, you can feel your pelvic floor just naturally evacuate your baby. And it is the most beautiful thing. So, and without it, you can also feel it, but, and you really feel it, of course. But that doesn't matter. What I'm telling you is what matters is preparing your pelvic floor so the baby can just easily evacuate. And I just wish people knew about this so they could have even more success in the form of VBACs. Of course, taking a VBAC class is also a great, asset and should be done. There's different VBAC classes that we suggest that you take with different providers. So Sharon Muja has a great VBAC class. She would be someone that you want to reach out to if you're hoping to have a VBAC. She has just a great VBAC class, really unbiased, tells you all the, let's see, I'm getting paused here. Okay. Tells you all the, stats and how to keep yourself safe during that VBAC. So her class is excellent. And I couldn't suggest that more. And pairing that with working with us during pregnancy to really prep the pelvic floor is just second to none. And so I wish everyone would do this. I shout it from the rooftops and I talk about it so frequently because it can change the world. I heard from a family member this week that had a vaginal delivery and she didn't do pelvic floor therapy during her pregnancy, but had texted me for tips and I gave what I could. But she ended up in the hospital after her birth because she tore all the way to her anus and wasn't able to fully even have a bowel movement on her own. And so, these are the stories that I hear and I'm like, they don't need to happen. There's so much that we can do preventatively during pregnancy. So if you are pregnant, absolutely seek us out. Come to a pelvic expert PT session. You need this, do this for your future self so you can recover quickly. So you can go home the next day with your baby. So you can avoid that C-section. One of the great texts that I received this week was that driving home after a vaginal delivery is tenfold easier than driving home after a C-section. So that warmed my heart, hearing that from a client. And that's why we do what we do, right? Let's make life easier. Let's prevent the surgeries, prevent the tears as best as we possibly can. So thank you and cheers to your vaginal delivery and your VBAC. And we're here to help you any way we can. Bye, guys.